New research from the National Institutes of Health shows Black and Hispanics are being impacted at a higher rate for long COVID. The study looked at the health records of 62,339 people who received a positive COVID-19 test between March 2020 and October 2021. The evidence shows that of those who suffered severe COVID and require hospitalization, disproportionately impacted Blacks and Hispanics. Now, months after their initial infection, those same Blacks and Hispanic adults with severe COVID were more likely to be diagnosed with diabetes and develop long-haul symptoms such as headaches, chest pain, anemia, and joint pain. Black adults are more likely to have blood clots as well as malnourishment. Hispanics more likely to experience dementia. Joining us right now from Atlanta, Dr. Jane Morgan, cardiologist and executive director of the Piedmont Healthcare Corporation COVID Task Force. Doc, glad to have you here. And of course, here's the thing here that what COVID showed. COVID, first of all, exposed for a hell of a lot of people who were not paying any attention whatsoever about how disproportionate our healthcare system is. Now we're seeing every day how COVID is impacting people much differently, which also, I dare say, goes back to all of those other factors that determine how white folks were having a different level of health care in this country compared to Blacks and Hispanics.
So what's really interesting, too, about these studies is that they are self-reported. And when we look at studies where there's an actual diagnosis of long COVID, we see the majority of those diagnoses have been made in white women, and generally white women who are in a higher socioeconomic status. So these are self-reported episodes of long COVID. And the reason that is concerning is that we see shades of racism in the types of impairments that we see in Blacks versus whites. So in Blacks, chest pain and joint pain and diabetes, but whites have more subtle cognitive impairment and fatigue. That requires some judgment and also some conversation. And it also can also be an implicit suggestion that the cognition of a Black person may not be high enough to determine that it is lowered. For instance, that's exactly what we saw in the NFL with their concussion protocols, right? So their level of intelligence was deemed to be slightly lower, so they were not able to qualify for disability for concussions when white players were. And so some of this is concerning. We will certainly have to tweeze this out. We saw obviously lots and lots of Black people being infected with COVID. And when we see long COVID, we certainly see long COVID impact, but a lot of that is self-reported. Does that mean because there are different demographics who are not having access to health care, or who have access but are not being heard, or who are working in jobs where they cannot leave and get the health care that they need even though they have access? So all of this is going to have to be teased out.
Indeed. And I think look, people also have to understand this, and this is where I think many of these nutcases on the right don't really understand what's going on. Folks like you are learning new stuff every single day. I mean, COVID is uncovering all sorts of things. Something somebody may have thought 6 months ago, it then changes. And so this notion that, you said this 6 months ago, yeah, stuff changed. And so there's an evolving that's going on here, which is why the research matters. And it's not just clear cut up. Hey, a year ago you said this, and it's the same today.
Research really does matter. And we see with COVID, again, sort of an underdiagnosis of these long COVID symptoms in Black patients. And we know that some of these medical algorithms and devices that are used to help assess a person's medical status have some racial bias in them. So for instance, the pulse oximeters, a little clip that we put on the end of your finger to measure the amount of oxygen you have, to determine if your oxygen level is low, if you are suffering from COVID or any other number of diseases where you might have a low oxygen level. That works by light passing through the skin. The more pigmentation or the more melanin you have, the less accurate is that device. And so you can have a low oxygen level in an emergency room and be feeling poorly, but actually that device read as being normal. And then you are triaged to a lower level of care and concern. We are not concerned about you. Your oxygen level is normal. We need to treat other patients ahead of you. Why don't you wait? And like anything, your status will continue to deteriorate. We have spirometry, where you actually blow into a tube and a machine measures your lung capacity, how much air you can expire in a certain period of time, gives you an idea of your lung function. And we know that in the software of that machine itself is a reading that calculates a Black person's lung capacity inferior to that of a white person's at about 15 to 20%. And so it automatically will downgrade if that person is Black and will give them a normal value that would be an abnormal value for a white person, who then would be guided and referred on for higher therapy and higher medications. And so we see that as well in COVID, and probably that is going to catapult over into long COVID and what these actual diagnoses are and who's going to actually get treatment and who isn't.
Questions from the panel. Matt, you're first.
The question I had, Dr. Morgan, was just how do you think we increase access as it relates to Black people and getting diagnosed for post-COVID? Because when I read this, that's what jumped out to me most, especially with you, indicating that this is primarily self-reported. So what do we get from this in terms of how we can increase access in our communities to get these diagnoses?
A couple of things. We need to advocate for ourselves, but we also know, and certainly in a paper that I published 2 years ago, looking at a number of COVID patients, we certainly know that the type of insurance that you have actually matters, right? That's going to determine whether or not you have access to generics, whether or not you'll need permission to see a specialist, how many visits you'll actually get with that specialist. So insurance, unfortunately, in this country is tiered, and it does make a difference between what type of health care you receive and what type that you don't. You should try to advocate for yourselves, educate yourselves, get good information. I'm trying to give good information tonight, right, to arm yourselves. And then not necessarily challenge your physician, but bring that information forward to say, I am concerned that you are not listening to me. You don't hear what I'm saying. And I would like to try again because I'm not feeling well.
Joe?
Dr. Morgan, thanks so much for being here. I really appreciate what it is that you're doing. I wonder, we had the question about how we advocate for ourselves. How well do you think in the medical field itself there is a recognition that these biases take place? And I'm sure you must feel like, you're trudging in quicksand all the time and sound like a broken record in terms of the things that you're pointing out. But how well is this known and recognized as an issue by people in the field themselves, in the medical field, and how outcomes are affected by insurance, et cetera, and how perhaps these other biases come in a way where two people that look different have a different tiered diagnosis, different tiered treatment? How much recognition is there of people that are in the field that are actually making these decisions that set some people on these roads and other people on other ones?
And so there are some areas that are gaining ground faster than others. One of those is kidney function. We have something called the eGFR, estimated glomerular filtration rate. It is a calculation that lets us know how well your kidneys are functioning. The higher that value, the better your kidney function. Well, in those formulas, there are generally two main formulas that we use to make those calculations, and it's done in the pathology lab. those formulas both have a multiplication factor for African Americans. It's actually called the AA factor, African American. And so at the end of the formula, if you are Black, there is a multiplication factor that artificially increases that value, that makes your kidney function appear better than it is. We finally have gotten recognition from the National Kidney Foundation in 2021, in September of 2021, and they recommended that these formulas no longer contain this factor. And just this month, a year and a half later, it has been determined that Black people, by using this EGFR formula, were delayed access to kidney transplant list, because you have to have a certain degree of disease in order to qualify for these transplant lists. Well, if the formula that they're using always artificially makes you appear healthier than you are, then you're actually deteriorating, but not able to get access to that kidney transplant list. And all medical facilities have been notified that they have within 1 year to now both identify and contact Black patients who should have been on these kidney transplant lists. So really, it's no longer a matter of how long have you been waiting on this transplant list. The question is, how long have you been kept off of it?
Wow. Great. Thank you, Doc.
Michael.
Hey, Dr. Morgan, thanks for this valuable information. In April of 2021, CDC Director Dr. Rochelle Walensky stated that racism was a serious public health threat, okay? And she talked about how COVID-19 disproportionately impacted communities of color. So when we look at your research here, we look at the information from the National Institute of Health, talk about understanding racism as something that's systemic. Talk about how those two relate, number one. And number two, what are some things that you recommend that can be done to fight against how the African American community is disproportionately harmed by COVID-19 and long COVID?
So many lessons.
Doc, that's a lot Mike wants you. Oh, Doc, that's a lot Michael wants you to do, but you got by 30. No, Mike, I got this. Doc, you got 30 seconds. That's my point. I know you got 1, 2 things, but we got 30 seconds left in the segment. Doc, go.
So many things to unpack during COVID with regard to lessons learned. One of those, though, is early in the COVID, when we saw the Alpha, the Beta, the Delta surges, we saw disproportionate impact in Black communities. And that was because, by and large, we were unable to step away from jobs. These are jobs that were, we call them essential workers. You live in multi-generational households, don't have access to pharmacies within 5 miles. We saw that pendulum swing in the last part of the COVID pandemic, where we see the majority of people now hospitalized and dying are white, and that's mostly because of the type of ideology that they're following. And so COVID is a great lesson in what our societal, infrastructural, racial construct is here in the United States.
All right, then. Doc, I got to do this here. So you had a birthday, what, about 5 days ago? And you, you didn't think I was going to do this. Come on, y'all. Come on, hurry up. Yeah. Oh, yeah. So you posted this. On your Twitter account. You like, well, you know, I might take it down. I was like, no. So now, was this from the party or was this from a previous party?
That was at the party. I had a surprise birthday party my sister threw for me. So this was at my party.
All right, then. Well, first of all, happy belated. And then even though if you try to take the photo down, well, this going to live forever with us showing it there. So that's why I want to go ahead and do that.
Yeah, and you can see in the background, you see my oldest son, Omar Jimenez. He's the CNN national correspondent back in the background there.
All right, then. Well, look, happy birthday, and I hope you had a great time there. Thanks a lot for coming on.
Thank you. I appreciate it. Bye.
All right, folks, back to our Roland Unfiltered video in just one moment. When you talk about blackness and what happens in Black culture, we're about covering these things that matter to us speaking to our issues and concerns.
This is a genuine people-powered movement.
There's a lot of stuff that we're not getting. You get it, and you spread the word.
We wish to plead our own cause. Too long have others spoken for us. We cannot tell our own story if we can't pay for it. This is about covering us. Invest in Black-owned media. Your dollars matter. We don't have to keep asking them to cover our stuff. So please support us in what we do, folks. We want to hit 2,000 people, $50 this month, raise $100,000. We're behind 100,000, so we want to hit that. Y'all money makes this possible. Checks and money orders go to P.O. Box 57196, Washington, D.C. 20037-0196. The Cash App is $RM Unfiltered. PayPal is R Martin Unfiltered. Venmo is RM Unfiltered. Zelle is Roland at RolandSMartin.com.